Okay. Welcome, everybody. We're joined by Dr. Rachel Herlihy, who's going to give us an update on the latest modeling and where we're at, and Amy Voth-Siebert, who's going to share some resources for Coloradans who are facing mental health challenges during this difficult time, especially as we experience a holiday season like no other. Brief update on where we are today, 3,693 new positive cases today. We have lost 3,321 Coloradans due to coronavirus, over 4,000 that have died with coronavirus. We always include both figures in our reporting, but 3,321 where COVID was the cause of death. My condolences to the families, the loved ones, the friends, and of course, our thoughts and prayers for those who are currently hospitalized, 1,403 Coloradans. We hope and we pray for their recovery. The positivity rate continues to show improvements. Today's is 7.19%. Our 3-day average, 7.93%. Why is that important? And you might recall our goal is to get it below 5. That is also a measure of how many of the COVID cases in the community we are successfully identifying. And to be able to identify enough for contact tracing and quarantine isolation to have a even greater impact, we want to get that number back below 5, which would show per CDC guidance that we have sufficient monitoring in the community. We're a lot closer today than we were a couple weeks ago, largely due to increased testing, slightly also due to a smaller number of people with the virus, still at a very high plateau in our community with well over 3,000 cases today, but at least it hasn't been increasing from where we saw it at some of the highs a few weeks ago. Dr. Herlihy will talk about the latest incidents and modeling. This week has been full of exciting news around the vaccine distribution. On Monday, we received our very first doses of the Pfizer vaccine. Next week, we're hopeful to receive our first shipments of the Moderna vaccine. I was, I've signed my name many times over the years on bills, on documents in business, but I never did it as joyously as I did when the delivery man came with the Pfizer vaccine and I got to sign the delivery slip, receiving those first doses for Colorado, now being administered largely to those who work in COVID wards, our first line responders, hospital workers across the state. Because this vaccine was issued under emergency use authorization, we are excited that it is being administered now. Now, there's also some good news and some bad news on the vaccine. I'll get into both. Bad news is the numbers for that we're going to get from Pfizer are lower next week, not just for us, for every state, than what we had been told before. And I do call upon the federal government. I saw Pfizer's pronouncement that they had doses waiting in the warehouse and they just needed to be told where to send them. We say send them to Colorado, but we encourage the federal government to get those distributed out. They're not doing any good in a Pfizer warehouse. So the Moderna vaccine, we expect the same numbers. That has not changed. Now, here's the good news. The good news is that with the Pfizer vaccine, and we don't know yet if this will be the case with the Moderna vaccine, with the Pfizer vaccine, our supply, each vial is effectively will have 6 doses instead of 5. It's what we're finding in the field. And that's really exciting news. We're hearing from providers across Colorado that the Pfizer vaccine vial is good for 6 doses instead of 5. So that's a 20% increase in the number of vaccines. So for all internal purposes in our state, we increase going forward, starting today, we increase whatever the CDC and federal government tell us we're getting for the Pfizer vaccine, we increase that by 20% in what we are accountable for getting into arms, for distributing. Now, if a vial or a set of vials only contain 5 doses, as some might, there is a way that the hospitals can then do additional paperwork and explain the discrepancy. But at this point, we're comfortable moving forward with the assumption that 6 doses is the norm per vial. And so the numbers that the state reports on Pfizer vaccine will show a different number than what the CDC says they are sending us. we will show a number that is 20% higher, and it will be revised downward based on actuals. So it might be a 15% boost or 16% boost. But when measured with precision, the providers in the field tell us that the vials should be good for 6 doses, and we're going to make sure that all 6 are administered in every circumstance. That's very good news for our state. If that is the case with the Moderna vaccine, we will very rapidly adapt our numbers as well and report different numbers than what the CDC is giving us. We will also increase those numbers 20%. We will not know that until we've experienced with the Moderna vaccine in the field, hopefully early next week. Another update on vaccines is that we've been planning for an allocation today of 67,860 next week of the Pfizer vaccine, but we learned that Operation Warp Speed's leadership has revised that. The new allocation is 39,780. Again, these numbers I report to you, and all numbers I report to you, will be 20% higher than the numbers that the CDC says, subject to downward revision based on actuals. But we are planning for the full 6 doses per vial. Of the 39,780 Pfizer vaccines next week, 25,000 are going to support on-site vaccination at skilled nursing facilities and 14,000 to hospitals. Moderna, we are still informed it is 95,600 doses. Once we have them and experience them, we will see if we're also able to revise that up by 20%, but we don't have that information yet. Let's talk about the 5-Star program. I want to applaud Mesa County for their leadership in pioneering the 5-Star program. Earlier this week, the Department of Public Health and Environment released the final parameters for the 5-Star program for restaurants in particular, probably the most urgent area. It certainly affects other businesses as well. But this is the pathway for restaurants to immediately get back to in-person dining in a limited capacity. We all know that many local restaurants have felt the impact of capacity restrictions. And this is a way to reward the businesses that are taking the right precautions for going above and beyond. And it's optional for counties and cities and completely optional for local governments. I'm proud to say that the first county has already been approved for 5-Star, Summit County, and they are beginning site inspections today to help restaurants open this very weekend for dining, which is really exciting to see that go into play. I also want to thank Larimer County for their interest in really stepping up and helping this program move forward. I expect and hope that they'll be able to move forward with the program, reopening restaurants across Larimer County, hopefully by next Wednesday. Qualifying businesses in counties that choose to stand up a version of the 5-Star program can immediately implement the safety measures above and beyond what is normally required, and are able to do that now. And I think it really is something that in a small county like Summit can be implemented in a few days. For a larger county, it might take a week, but it is a very reasonable, safe, quick pathway to helping have some in-person dining soon. And I want to thank our thought leaders and health leaders in Mesa County, along with the many other health leaders across the state who helped to establish a program that we can be confident in. Depending on a county's level and metrics, businesses are also eligible for less restrictive caps as the virus decreases. In effect, if a county is orange on the dial, as an example, businesses that certify as taking these precautions can operate as if they were in yellow, so 1 degree less restrictions. And Colorado Department of Public Health and Environment began accepting applications today, and the very first one to be approved is Summit County in time for this weekend. And whether or not a program like this is right fit for a particular county, I want to encourage everybody to support our local restaurants by doing takeout, delivery, eating outdoors. It's a great way to support our iconic local businesses. We order in 3 or 4 times a week, and we're very proud to support our local restaurants or do takeout. Now I'd like to turn it over to Dr. Herlihy to share some of the latest trends that we're seeing across the state with regard to the health crisis and the trajectory of the deadly virus in Colorado. Dr. Herlihy?
Thank you so much, Governor. Good afternoon, everyone. So as we walk through the data today, you'll see that our numbers remain high overall and call for continued action, but we are seeing improvements. Next slide. So this figure shows you our case counts in Colorado. In gray, you can see our daily case counts with each of those vertical bars. The red line shows you our 7-day moving average for our number of cases. In this figure, you can see a clear peak in mid-November. You can see a small increase in cases that occurred in early December. And then since then, we've really had this continued downward trend over the last 2 weeks or so. And while we're seeing these improvements, obviously our rates continue to be high in most places across the state. Next slide. In this figure, you see Colorado's case rate in green and a US case rate shown in blue. And the steady downward trend that we're seeing in Colorado is actually not commonly seen across the country right now. So in fact, if you look at our trend specifically in Colorado, it's really much better than what is being seen in most states around the country. And this is really because Coloradans' actions and Colorado's policies have made a difference and prevented a substantial Thanksgiving surge and really have led to the declines that we are seeing now. Next slide. This figure specifically compares Colorado case rates to counts in several other states that, like Colorado, were experiencing rapid increases in cases in November. Keep in mind, this is case count data, so Colorado numbers are going to look smaller because our population is smaller than these states. But if you take a look at the shape of the curves, you'll see that Colorado, shown in orange, has bent the curve following Thanksgiving. We've really continued to see that downward trend. Similarly, Illinois, who took similar policy measures like our red dial before Thanksgiving, has also seen mostly a downward trend. Ohio is doing a little bit better in the last couple of days, but did see a major post-Thanksgiving bump. And Pennsylvania similarly saw a big jump after Thanksgiving and continues to go up. These are, of course, just a couple of examples of states, but I think it really highlights the success we've had here in Colorado in bending the curve and achieving virus suppression in the state. Next slide. Our hospitalizations continue to be high, just like our cases, and continue to strain our healthcare system and our healthcare workers. But we really are starting to see some clear improvements here as well. The horizontal dotted line shows you that we still have a way to go, even just to get back to our spring peak level. So again, rates remain high, but certainly moving in the right direction. Next slide. Again, as with cases, this improvement isn't being seen across the entire country. This figure shows you Colorado's hospitalization rate for COVID in green and the US rate in blue. And while Colorado is trending down, what we see here is that the US overall continues to trend up. Again, another indicator that Colorado is having significant success in containing this virus and suppressing the virus. Of course, keeping in mind that overall our rates of cases and hospitalizations do continue to be high. Next slide. So one place where we haven't yet seen improvements is in reported deaths. This figure shows you reported deaths among COVID-19 cases in Colorado based on the date of death. The numbers remain higher than they've really ever been since the beginning of the pandemic. In fact, half of Colorado's COVID-19 deaths have occurred in the last 2 months. You can see that up until the shaded area where we expect deaths to not yet be reported, we continue to see an increasing trend. We certainly hope to see improvements here soon. We know that death reporting lags, and so it's not unexpected for us to see this data, the death data, lagging behind the improvements that we're seeing in cases and hospitalizations. Next slide. In this next figure, we project what infection numbers look like if we can continue to maintain our downward trajectory over the next several weeks. If we can avoid a Christmas and New Year's spike, we can get our numbers back down to spring levels in time for school reopening in mid-January. And we can get back down to the numbers where we were this summer by mid-March or so. That's really nearing the time, mid-March, is when we hope to start seeing population level protection from the vaccine. So really when we start to see the true impact, the herd immunity potentially from this vaccine. However, a holiday spike that occurs in the next week or two could potentially set us back several weeks on this timeline. And this is really where we're asking for Coloradans' help to step up once again, like we did over Thanksgiving, to help us stay the course through this holiday period and make sure that we don't see a holiday spike following Christmas and New Year's Eve. Next slide. So, the most rapid path to reopening, saving lives, and in person learning in January really is preventing a Christmas and New Year's Eve spike. And so, as I mentioned, we really need Coloradans to step up again, just like they did over Thanksgiving, to help us contain this virus over the next couple of weeks to make sure that we don't see that spike and that we can continue to be on the good trajectory that we've been on for the last couple of weeks. Next slide. And so we are asking Coloradans to take 3 key steps. First, when possible, only interact with people from your household. Keep your distance at least 6 feet at all times, and wear a mask if you must go out in public. For some additional winter holiday tips, you can visit our website, covid19.colorado.gov, and check out tips on how to safely celebrate the holidays this season. With that, I'll turn it back to the governor.
Thank you, Dr. Hurley. This really goes to show that Coloradans are stepping up and made, by and large, the right choices over Thanksgiving. And thanks to the sacrifices that people made over Thanksgiving, not in many cases involving not seeing their loved ones, or we were not seeing the same spike as other neighboring states. Right now, we are at 1 in 59 Coloradans are currently contagious with COVID-19. Now, that's better than 1 in 41, where we were just a couple weeks ago. But keep in mind, when 1 in 59 Coloradans are contagious, just think about how you can reduce the number of folks you encounter. If you, in the store, walking around, encounter 20 people a day, then it means over the course of the week, you will be exposed to someone with COVID. Now, if you're both wearing masks, that will reduce the likelihood of transmission greatly. Even if you're just wearing one yourself, it reduces the risk by 50%. So you will likely encounter people who are contagious. Some of them might not even know. Some of them might suspect. We hope that anybody who's experiencing any symptoms is staying home. That's another important part of our collective responsibility to our community. But right now, 1 in 59 Coloradans are contagious with COVID. Wearing masks, avoiding social gatherings, staying at least 6 feet from others. This will help us rapidly change the scary trend that we've been seeing across the country, and what we worry about here in Colorado. If we can get through Christmas as we did through Thanksgiving in a safe way, I think we'll be well on our way towards the vaccination having an impact and moving forward. We need to continue and keep it up over the next few weeks. It's going to be crucial to getting our kids back to school in January successfully. We've all sacrificed so much psychologically, emotionally, but if we can stay on track, we can make in-person learning a reality for all of Colorado's kids, something that our kids need, and frankly, our parents need as well. And I know traditionally the holidays, time to see family and friends. There are some who've been self-quarantining for a period before they plan to get together for Christmas. That works. If you can quarantine yourself for 10 days before you see family members, avoid contact with others, then you have a lot less to worry about with regard to transmission. But this year we have to really think about how we can make Christmas meaningful for ourselves and our families without putting the lives of our aunts and uncles and parents and perhaps even ourselves at risk. Maybe spending Christmas morning around the tree, opening presents with your immediate family. And, there's different ways to do it. Others are celebrating virtually with family members across Colorado, across the country, across the world. Other families I know are saying, you know what, we're going to have Christmas in July. We're going to have 2 Christmases next year. And of course, the religious component of Christmas, if you are attending a mass, make sure to do so in a very safe way, social distancing, wearing a mask. And I would really strongly encourage, given the 1 in 59 people are contagious figure, if you are in your 70s or 80s or 60s or a pre-existing condition, I would strongly recommend, as many faith leaders have of all different faiths, find a way to celebrate remotely or virtually your faith, knowing that it's important that you're there to celebrate your faith in person for many years to come. We all know we need to be celebrating with those we love, and we just have to think about whether what works for us is a quarantine period before, a virtual celebration, Christmas in July, some combination thereof. I know it's a difficult thing to to do for any of us. But of course, the worst gift that you can give this holiday season is coronavirus. I've used the analogy that we've been running a marathon. This is 2020 is just a terrible year for humanity across the world. Well, now we're nearing the end of it, and you're dehydrated, sore, desperate to finish. We're 100 yards from the finish line. Now's not the time to break down. If we can prevent a Christmas and New Year's spike, as we successfully did a Thanksgiving spike, this is just our last worst stretch, and we need to make it to that finish line. And keep this in mind if you're doing any last minute Christmas shopping, shop local, support our local shops. You can utilize curbside delivery to be even safer. Avoid crowds, order with local stores online, and they can bring it right out to your car. Or you can enter the store, of course, wearing a mask. But let's try to support our local businesses. They've had a tough year too. Our restaurants, our shops. Let's be careful, but let's be creative. We can celebrate with the people we love in new and different ways without putting anybody at risk and without costing life. Next year, we'll get back to our old tradition. Some families will even have 2 Christmases next year, Christmas in July and Christmas in December. But this year, we need to celebrate at home with the people we live with to avoid unnecessary loss of life. That's the biggest driving factor. Yes, it means we can return to schools sooner. Yes, it means restaurants can open sooner. Yes, it means less people will die. But most importantly, and I know what drives everybody, is concern for not just the statistics, but your own family. And everybody loves mom and dad and aunts and uncles and grandparents. And we really, truly want them to be here for many, many years to come. And we can show that love this holiday season by celebrating in a safe way. This is a tough time for people. I correspond with some elderly friends that have been in nursing homes and have very limited visitation. I haven't seen my parents in 9 months. And I'm grateful for that, because there was a period of time where I was contagious. And had we lapsed or had I seen my parents, it could have resulted in great loss for our family. But I know that this is hopefully the very last big holiday that we have to be a part. I'm looking forward to seeing them soon. And throughout this pandemic, it's been tough, mentally, emotionally, spiritually, for many Coloradans. Isolation, depression, anxiety. Humans are social animals. By nature, we want to be around others. And these feelings are traditionally made even more difficult during the holiday season, especially as we're physically away from loved ones. There's been a 600% increase in telemedicine use for anxiety, depression, and substance abuse. For anyone out there experiencing mental health challenges or experiencing a crisis, or if you just need someone to talk to, please call Colorado Crisis Services at 1-844-493-8255. You can also visit Health First Colorado or our substance abuse and mental health services near you at findtreatment.samhsa.gov. Now, to talk more about how we can support our mental health during a very different and somewhat scary holiday season, I'll turn it over to Amy Voth-Siebert, the Disaster Behavioral Health Lead at the Colorado Department of Public Health and Environment. Amy?
Thank you, Governor. Those are wonderful resources for Coloradans to know about, and I'm really pleased to join you all to share a few more tips and resources to care for our mental health during this holiday season. Holidays are like mile markers in our year. We organize our schedules around them. They help us mark how time is passing and how things have changed, and our brains really like that certainty. Disasters like this pandemic, unfortunately, can shake up a lot of our routines, including how we spend our holidays. Holidays are also rituals that bring our families and our communities that meaning, joy, and connection. So even as we adjust our holiday celebrations to be safe this year, we want to find creative ways to keep their meaning, joy, and connection. So maybe we choose a favorite holiday treat and make a little bit extra so we could leave some on a neighbor's step with that safe social distance and washing our hands as a gift. Maybe we call someone to talk about our favorite holiday tradition or what it means to us. Maybe we can write an end-of-year letter sharing what we're grateful for or something that made the year better. It's been a tough one, but continuing to ask that question, what has made it better, can be really helpful. And this is absolutely a year to do what you can to help others. Many people will need extra support this holiday season, but our stress response makes us want to care for other people too. And it can be good for us to feel like we are making a difference. So consider delivering food to a food drive or pantry, donating clothes or home goods to a charitable cause. And like the governor was saying, holidays can be an especially hard time some years because they are also times when we notice the more difficult changes that have happened, like loss and loneliness. Disproportionately impacted communities in Colorado may have feelings about the holidays that are layering on top of ongoing stresses and inequities. As individuals, we may be feeling more isolated this year. We're mindful of families who are experiencing their first holiday season since losing a loved one. This season may bring a new wave of grief because we're surrounded by events, rituals, people, places that remind us of that person. This may also be when we're taking stock of how our hopes and expectations for this year were dramatically changed. These are painful things to get through, and it may mean that the holidays don't feel quite the same. But give yourself permission to grieve. There's no right or wrong way to grieve and no timeline for these feelings. A great gift we can actually give each other is to listen and hold space so we don't go through our losses alone. And maybe you might consider doing something during the holidays that helps remember somebody that you've lost. Light a candle, listen to music, or maybe do another seasonal activity that your loved one would enjoy. Above all, remember to stay connected. Being apart physically doesn't mean we need to be disconnected from each other. Not only are there many people and resources to support us on hard days, there are also skills that we can learn for our own mental health. Here are 3 more resources to complement the list that the governor has already shared. The Colorado Spirit Crisis Counseling Program is designed to support people who have been impacted by COVID-19. CCP teams of trained crisis counselors offer free and anonymous services around the state. CCP crisis counselors are members of the community too, so they know a lot of the challenges that people are facing. The crisis counselors support individuals, families, and groups to understand and reduce stress, develop coping strategies, and connect with other community resources and relief services. Whether you or a family member tested positive for COVID-19, maybe you lost your job, or your holidays are just feeling harder, this program is here to support everyone's experiences during the pandemic. So visit covid19.colorado.gov/crisis-counseling-program to find CCP support near you and help share it with others. Similarly, Colorado Ladders is a database from Colorado's Office of Behavioral Health to help people find substance use treatment and mental health providers near them in Colorado. Visit colorado.gov/ladders. Finally, the University of Colorado at Colorado Springs is home to the National Institute of Human Resilience. They have a Grit Resilience course that you can take for free at your own pace. Learning and practicing the grit resiliency skills can help each of us support one another's mental health and resiliency in everyday interactions. Visit grit.uccs.edu to take the training and help grow resiliency skills in your communities. Even if you don't feel a need for these resources right now, I invite you all to write them down so you can use or share them in the future. This holiday season really is unique, and it may be especially hard for some of us. So let's use this as a reason to be kind to each other and intentional about caring for our mental health. Back to you, Governor.
Amy, thanks. And I think in short, if you need help, ask for it. If you are having troublesome thoughts, feelings, emotions, experiencing anxiety, depression, ask for help, whether it's one of the state resources, whether it's a close friend, whether it's your own psychologist or psychiatrist. Please reach out. This is a tough time for everybody, especially the holidays are always a tough time and mental health issues go up. But this one is like everything this year, is particularly tough. Look, over the next few weeks, we need to continue doing what we know works to slow the spread of the deadly virus. Wear a mask, avoid social interactions with others whenever possible, people outside your house, and stay 6 feet away from others who don't live under your same house. I am proud of how Coloradans did our part for Thanksgiving. And I know that we can do it again for Christmas and New Year's Eve, the final few hundred yards of this very difficult and deadly marathon. There's hope on the horizon with the vaccine. It's being distributed already, frontline workers, residents of nursing homes next week. So let's keep it up. With that, I want to wish all of Colorado a Merry Christmas, Happy New Year, and may health be with you. With that, we'll take questions.
Hi, this is Lori Jane Glehoff from Fox 31, and I just wanted to see if you could please clear up why was the anticipated number of Pfizer vaccines in this most recent shipment so far off from what we were actually getting? If you could explain that discrepancy and also explain how that lower number of vaccines will impact us. Will it impact the timeline to roll out the number of people who are able to get it?
So I really, call upon the federal government to get the Pfizer vaccines out. Pfizer has said they are sitting in a warehouse awaiting shipping instructions. The federal government needs to give them those shipping instructions today. The same pro rata distribution based on our share of the U.S. population. Colorado's 1.69% of the U.S. population. We get 1.69% of the amount that are shipped. Now, the decrease in the Pfizer vaccines for next week, we don't yet know whether that is a expected decrease for future weeks as well. The federal government gives us 1 week visibility into the number of vaccines we will receive, and they have revised the number of Pfizer vaccines down for next week. That is partially offset by the fact that we translate into, for all state purposes, 20% more doses. When we do the math, we're also grateful that they are still committed to the full number of doses, over 90,000 of the Moderna vaccine.
Are you able to just really quickly expand on that, though, as far as how is that going to impact us? Is that a bad thing that we have fewer doses than you were expecting?
Well, I think that it makes a difference whether it's a 1 or 2 week delay or whether this is a several month delay. At this point, the federal government has not clarified. The best case scenario, the one I hope for, is that this is, for whatever reason, a short delay of a week and that they will catch up a week later. But we don't yet know that, and we will continue to urge the federal government to work with Pfizer to get every dose of the vaccine out as quickly as possible.
Hello, Governor. This is Vinny Delchudice at Bloomberg News in Denver. 2 questions today. On COVID, JBS, which owns the packing plant in Greeley, says it's offered states deep freezers for vaccine storage. Will Colorado be working with JBS? Now, number 2, on another topic, have Colorado government computers been hacked in the broad cyber attack by suspected Russian hackers? Bloomberg News is reporting at least 3 states have been hit, in addition to the federal government. Thank you, sir.
Colorado has over 2,000 freezers that are capable of storing the Pfizer vaccine, including almost every hospital. When it gets to the nursing home level, the preferred vaccine that will be used is the Moderna vaccine because it needs to be kept at normal freezing temperatures. Every nursing home has a normal freezer. So the two are both highly effective, clinically almost identical, 94 to 95% effectiveness. And we have sufficient cold temperature storage across Colorado, particularly in the hospital and medical settings, to successfully deploy all of the Pfizer vaccines that we receive. And with the Moderna vaccine, we have even more flexibility to go to anywhere that has a normal freezer. With regard to the hacking situation, it's an evolving situation. Our state closely monitors all alerts and directives issued by the Department of Homeland Security, including taking the proper steps as a state to investigate and act on any vulnerabilities that are discovered or identified. It is an ongoing situation around the country. And of course, it's very alarming when we're hit with any cyber attack at any point. And we're looking forward to working with our federal partners to learn more about any implications in Colorado.
Hey, Governor, Jesse at the Colorado Sun. 2 questions. One, are you all worried about a holiday spike stemming not from Coloradans, but from people coming from out of state to visit the high country? Obviously, Christmas and New Year's are big travel times for people to come skiing. And also, are you guys taking any extra steps to try and keep folks who are visiting malls and other retail sites safe, given last minute shopping often crowds people closely together?
Yeah, so I am encouraging that we support our local shops and order ahead, and they offer curbside delivery. Obviously, some people like to see the merchandise first, and that's fine if it's what you need to do, and make your shopping as efficiently as possible. Another tip for people is to shop off of the key hours, right? So on a weekday, stores are usually busier, 4:30 to 6. Try to find a way to shop on your lunch break or in the morning. On weekends, particularly early and particularly late, are better than midday. So shop off peak, curbside delivery. Those are two good tips to help keep yourself safe. Jesse, what was your first question?
Sorry, the question was, are you and Dr. Hurley worried at all about a Christmas or New Year spike being related to visitors and not necessarily Coloradans?
Yeah. Look, it doesn't matter where somebody's from. We have 1 in 59 Coloradans are currently contagious with coronavirus. There's places in our country that have higher infection rates. There's places in our country that have lower infection rates. But the most important thing is that we treat every encounter we have like the other person might be contagious with coronavirus, and they might not know it. That's why wearing masks is so important. It's why keeping a distance of 6 feet whenever possible is so important. It's why so many stores have really stepped up to have ways that you can wait in line 6 feet apart. Many of them have put barriers, fiberglass barriers in place at checkout. So it doesn't matter where someone is from. What matters is that we treat all the personal interactions that we have as if the other person is potentially contagious, because whether they're from Texas, California, New York, Aurora, or Grand Junction, they might very well be contagious with coronavirus, and we need to exercise all due precautions.
Hi, Governor. This is Mark Salinger with 9 News. I want to follow up on a question that was asked earlier by someone else. You said that you aren't 100% sure why these vaccines aren't necessarily coming to Colorado, the lower number. Would that be fair to say that you have not been told why Colorado is getting a lower number of vaccines? And at this point, how do you determine which hospitals or health departments don't get a vaccine in this first round of doses because of the lower number?
So to be clear, this is not a Colorado-specific issue. In discussions with other states and other governors, every state that we have been in contact with has had a similarly revised downward number of Pfizer vaccines for next week. So we have the same number of Moderna vaccines that we expect next week. That is the 96,000. The Pfizer vaccines have been revised downward, but then we are internally revising them upwards by 20% based on 6 doses rather than 5. It still doesn't equate to the initial dosage. So yes, again, it means that some that were otherwise scheduled to get the first vaccination next week might have to wait till the following week or the week after to receive that vaccination, with the continued prioritization of people who work in and around COVID patients in the hospital setting, and residents and staff at long-term care skilled nursing facilities.
Hi, this is Erin Prater with the Gazette in Denver and Colorado Springs. Regarding the reduced number of vaccinations that are expected, is there any worry, and perhaps maybe not this next week, but that individuals who have received their first dose due to a shortage might not be able to receive that second dose on time? And what would happen if so? Also, I don't know, is there any wiggle room in that window? And if they don't receive a second vaccination in that window, is it null and void? What is the consequence of that? Thank you.
So there is no concern about that, because for every dose administered, there is a mirrored dose that is held back for that person that will be delivered 21 days later in the case of one vaccine, 28 days later in the case of the other vaccine. So we still have confidence that those mirrored doses will be ready to go. While the exact protocol that was tested was 21 and 28 days, it is understood among the scientific community that there would be some leeway for the shot to be administered later based on similar experiences with other vaccines. But we would preferably keep with the demonstrated protocols that show the great efficacy of the 21 and 28 day gap.
Hi, Governor. John Daly, Colorado Public Radio. Thanks for taking our questions. Wondering if you're hearing about any cases or signs of hesitancy out there so far, and also what the state plans to do in general about that, particularly amongst some communities of color that might have some suspicions about the vaccine.
Well, right now there's more enthusiasm and excitement to get the vaccine. It's among those who work with COVID patients. They've seen the devastating toll of this virus, and I've heard from so many of them, and they're very excited to get the vaccine. Among the general population, our research indicates that there is 60 to 70% that are excited, ready to receive it. But we do worry about the disproportionate distrust of vaccines in the Black community, where 50% of folks, according to our research, are not yet comfortable receiving it, and in some other populations. So we are doing everything we can to increase trust in what is truly a gold standard, highly effective vaccine, including a number of steps that we are taking to work with community leaders and communities of color and help make sure that they have the very best science in front of them to make the best decision for themselves and their families.
Hi, Governor. This is Amber Fisher from Denver Patch. My question was actually similar to the previous questions about the reduced number of vaccines coming into Colorado. And actually, the Federal Department of Health and Human Services just got back to me a few minutes ago, and they're saying that states are getting it wrong, and that their estimations were indeed accurate. This definitely brings up a lot of questions in terms of what is going on. I mean, is this acceptable during a pandemic to have a he said, she said between governments like that?
Well, we count them when we get them. We also increase the count by 20% over what Pfizer says that we are getting, and CDC says what we are getting. Hopefully, the light that has been shined by the states that have called out this revision in the number next week will result in going back to the original numbers of vaccines, the same number that we received this week of the Pfizer vaccine. So if that is indicative of what was said, that they would be returning to the expected number that we received this week, that would be welcome news. And I'm hopeful that will be the direction that will occur. We will, of course, be fully transparent about how many doses are received in Colorado and when.
Governor Charles Ashby from the Grand Junction Daily Sentinel. So about 3 weeks ago, after the legislature finished its special session, I asked you what new stimulus ideas you were going to present next session. You said a lot of that would depend on what Congress approves and the revenue forecast for December, which we got today. Now, obviously, we know that Congress isn't going to be approving any money for state and local governments, but today's revenue forecast was at least promising. So I'm wondering if you can tell me specifically what you're hoping to present to the legislature to help the economy recover from the pandemic, and if you can include the OIT request for broadband money.
Yeah, so we included a $1.3 billion stimulus request in our initial budget. Of that, we, through executive order on the $375 one-time stimulus payment to people who had experienced unemployment, and working with the legislature in the special session, have allocated approximately $500 million of that, leaving about $700 to $800 million in stimulus to work with the legislature on. The biggest pieces include shovel-ready infrastructure, which creates jobs and reduces traffic, including money for downtown projects. That Grand Junction was a recipient of the first round of a grant of $50,000. This will allow for much larger grants for revitalizing downtown areas, money for improving capacity at our state parks, money for fire prevention, and a number of other key areas that we look forward to working with Democrats and Republicans in the legislature to be able to get done, to create jobs today and invest in one-time stimulus that will be utilized over the next 12 to 18 months to build lasting improvements for our quality of life that give us a competitive advantage over time.
Hello, this is Mo Clark with Colorado Newsline. My question is for Dr. Herlihy. I'm wondering how CDPHE will determine who falls into the chronic illness category in phase 2 of the vaccine plan. And I'm thinking specifically for people who are incarcerated in jails and prisons. What sort of documentation is required and how will eligibility be assessed? Thank you.
Yeah, thank you for the question. So I think there's two things really. The first thing is we are waiting for updated guidance from the federal government, from the Advisory Committee on Immunization Practices, or ACIP, on prioritization for that phase. So we really are waiting for additional guidance from the federal government. Second, we are working here in Colorado on prioritizing within these phases. And so it'll be combined work of really both the federal government and Colorado to make those determinations. At this point, we're really primarily focused on this first phase and making sure that we're really prioritizing the groups in this first phase.
This is Brian Ulmer of the Barn and the Colorado Ag News Network here in northeastern Colorado. Good afternoon, Governor Polis. I understand that Colorado County is incorporated, along with numerous public health directors and the Colorado Hospital Association, sent a letter to you earlier this week asking to meet with you. Have you met with them yet, or are you planning on meeting with them soon to discuss the rural healthcare situation as it pertains to the COVID pandemic and subsequent COVID vaccine distribution here in rural Colorado? Thanks for taking my question.
We have weekly calls with all the rural hospitals. I am usually on those at least 2 out of every 3 weeks, and we always have an opportunity for them to comment, suggest, ask questions. We've been doing this for the last several months, and it's been a very good discussion. I also have regular calls with city and county elected officials throughout the state. And was there any other group that you indicated, hospitals and elected officials, any others?
Within that group, including the Colorado Counties Incorporated and some commissioners too.
Yeah, so we talked to CCI leadership and staff regularly, and then we worked very closely with commissioners in areas that were interested in developing, most recently, the 5-star program. Generally, when we have new guidance that goes out, like the 5-star program, it goes out for comment several days ahead of when it goes live. It's a condensed comment period, of course, because we want to reopen restaurants safely as quickly as possible. But folks did have 3 days to be able to get their comments in. And generally, when we have new guidance that goes out, we give a few days for people to enter their comments, and we reflect those comments in the final decision items. And we particularly value input from county elected officials and hospitals.
Hi, Governor Polis. This is Matt Bloom with KUNC News in Greeley. Will you extend the state's eviction moratorium once the CDC's expires, and why or why not?
So right now, there will be a short-term extension of the eviction moratorium pending the language that will be in a federal deal that we expect as soon as this weekend that will likely contain new language in statute around evictions. Right now, our order reflects the CDC order with regard to evictions moratoriums. Since federally, that will likely be superseded by statute in the omnibus bill that is now being discussed. We will then update our eviction modifications next week after we see the language that gets signed into law. But ours, the current one, which is the one that is based on the CDC action, will be continued short-term for the next week.
Hello, this is Meg Wingeter from the Denver Post. I wanted to ask you, you're saying people should continue their current level of precautions, at least until we can get schools back in, but also saying that for some businesses, they're going to be able to have a higher capacity, at the same time telling people, avoid crowded spaces and such. How did you decide that these specific exemptions would be all right, would not drive?
Are you talking about the 5-star program?
Yes.
So first of all, we have data from Mesa County that show that it works, but it precisely avoids the kind of environment like a crowded room that could lead to increased transmission of the virus. It includes additional safety precautions that would be taken in restaurants that were able to open at increased capacity, such as 10 feet between tables. And of course, the single biggest risk factor with regard to dining is who you dine with. And, you know, you have a large party of people with different households, there's a very high chance of viral transmission when you have 1 in 59 people who are currently contagious. So one of the goals of a safe dining experience is to be able to dine with people that you live with, that are from within your household, in a safe way, at a safe distance from others. And it's really something that will work in providing that kind of dining experience and supporting job creation. And we're also optimistic that it will not lead to significantly increased viral transmission. I want to thank everybody for joining us. And I want to wish everybody a happy and safe holiday season. As you make your final plans, just remember that we are almost there. And if we can avoid a setback this Christmas and New Year's, as we did in Thanksgiving, we'll finally be able to move forward with the vaccine, with kids going back to school, reducing the unnecessary loss of life, and finishing the marathon. So wear a mask around others, avoid socializing with people outside of your household, and when you are interacting with others in a store or anywhere else, try to keep a distance of 6 feet whenever possible. Merry Christmas and Happy New Year.